Hello, I'm Amy,
And I'm Ellis.
and we work for a charity called Gobaith Morn.
Gobaith Mourn's a youth initiative that works through the churches of Anglesey, reaching the young people.
And here's our assembly this morning. Good morning, and welcome back to our assemblies. This morning, we're going to be looking at connecting.
To start our assembly this morning, we have a little challenge for you. So on the screen, there's going to be some pictures of different things. Can you tell what connects all the things together on the screen? So the first one, they're all chocolate bars. All these cities that are on the screen are either capital cities or they've also hosted the Olympics at one point. And for this one, all these films were filmed in Wales.
It was so important for us during the lockdowns that we've had to keep connected to each other. And there's so many positives to talking online, especially when we could not see each other face to face. First of all, it kept us safe. It was a way of being able to talk to our friends and our family that we don't live with outside of our households without the risk of passing on the virus. It kept friendships going, and friendships are very important for our mental health. And it gave us a chance to connect with new people that perhaps we hadn't connected with before or for a long time. But now we can see each other face to face, and we just have 3 top tips on what to do now that we get back to seeing each other face to face. So you could be nervous about approaching a big group of people after spending so much time by yourself or just with your family. If that's you, then perhaps ask your friend, one of your friends, just come alongside you a little bit more and tell them that you're feeling a little bit anxious about being in a bigger group of people. Have positive conversations with your friends. It's so easy to weigh in on the negative and to think about the things that are perhaps not going so well, but have positive conversations. And try to be understanding of everyone's experience. Not everyone will have experienced these past 18 months the way that we have, and therefore we need to be understanding of what others may have been through.
Here are some pictures of Catherine Wolfe and her husband Jay. Catherine was a model and Jay was training to be a lawyer. In 2005, they moved 2,500 miles from their home in LA, and in 2007, Catherine gave birth to her first son, James. On April 21st, 2008, just 6 months and 5 days after James was born, Catherine collapsed in her kitchen while baby James was asleep in another room. Catherine had suffered a major brainstem stroke. She was rushed to UCLA Medical Center and she wasn't expected to live, but by some miracle she did. But of course that was just the beginning of their struggle. Picture this, a baby, a father studying law, and a paralysed mother. They were over 2,000 miles away from their family and friends, and this time they really needed them more than ever. But through this time they were surrounded by a community that they had through the church, and Jay said that they were just as close as family. Jay recalls one time that when Catherine was in surgery for 16 hours, over 100 of them came together to pray, cry, laugh and eat pizza to support Jay while he was waiting in the hospital waiting room.
And here's the word of the week from the Bible, which says, let's think of ways to motivate one another to acts of love and good work.